study shows that antibodies generated by Pfizer's COVID vaccine rise more slowly and decline more quickly than Moderna's.
In fact, researchers say they were kind of surprised at how quickly those antibodies fell in Pfizer recipients. Ashley Hendricks explains what this could mean when it comes to protection against COVID.
A drop in antibodies does not mean less protection, according to researchers. But the study does highlight the importance of getting boosted, that needle moving slowly towards better protection in Virginia. As COVID vaccines rolled out, researchers have used antibodies to study vaccine effectiveness. Dr. Jeffrey Wilson says they're your body's first line of defense.
The antibodies recognize specific things on the SARS-CoV-2 virus, including the spike protein. And having antibodies that recognize the spike protein can help protect against infection.
But in a new study, he found that defense varied between the Pfizer and Moderna shots.
We were interested to see the levels that you got to after the vaccine and then just see how fast they dropped off. And as we show in the paper, we did see at least a subtle difference in how fast that drop-off occurred between the Pfizer and Moderna vaccines.
For 10 months, researchers tracked antibody levels of nearly 250 vaccinated UVA employees. 114 had the Pfizer shot and the same number of recipients had Moderna, while 6 had Johnson & Johnson. After 6 months, Pfizer recipients had fewer antibodies than Moderna recipients and fewer antibodies when compared to patients who previously had severe COVID.
The antibody levels drop over time. That is not new at all. That always happens, and that's part of a healthy immune response.
Dr. Wilson also found fewer antibodies in Pfizer recipients who are 50 and older. If you have Pfizer's vaccine, don't worry, you're still protected.
You get B cells that can have memory, and you make T cells, and they can have memory. So even if your antibody levels drop, you still have a lot of immune cells that can get recruited and fight the infection.
While initial vaccinations are up in Virginia, VDH says there are not as many people getting booster shots. Researchers say booster shots means more antibodies to help better protect against COVID-19. On your side in Richmond, Ashley Hendricks, NBC 12 News.
Accurate,